Hello, my name is Juliana. I'm going to be your student nurse practitioner today. Can you please confirm your name and date of birth with me?
Sandra, 10/26/93.
Very good. This matches our records in the chart. And do you know why you're here today?
An assessment.
Okay, yes, we're here for a focus assessment. We will be doing an assessment of the HEENT system: head, ears, eyes, nose, and throat. Starting with my assessment, I'm going to be inspecting my patient. Her head appears to be normal cephalic. I don't see any lumps or bumps present. Now I'm palpating. She has good distribution of her hair. Her scalp appears to be appropriate. I see no signs of dryness or any redness or patches noted. Her skin is appropriate and within defined limits for her ethnicity. Starting with the eyes, have you been experiencing any blurry vision or double vision?
No.
No? Okay, very good. From here, I'm checking out her sclera. Her sclera is white. There's no redness and there's no yellowing of the sclera, which would be some jaundice. We're going to be checking the cardinal field of gaze over here. Right here, I'm going to ask you to please look at my pen light and follow it with your eyes only and do not move your head. Here we're checking for lateral, inward, and outward movements of the eye, cranial nerves number 3, 4, and 6, which is ocular motor, trochlear, and abducens. The eyes have smooth movements. There's no nystagmus present, so the cranial nerves here are intact. Now I'm going to be checking her pupils. I'm going to be using my pen light, shining a light in her pupils to see for light and accommodation. Open your eyes for me. Look at me. Very good. Very good. Her pupils are about a 5, but once light is shined into the eyes, they constrict to about a 3. Here, I see the pupils are pearlite, equally round, and reactive to light and accommodation. For this next part of the exam, we're going to be using my ophthalmoscope, and this is the fundi exam. Here I'm going to be checking for the fundi of the eye. The exam is somewhat limited due to there's no dilation of the pupils, but for the purposes of this exam, we can see the fundi, and the lights should be dim. I'm going to shine a light, my right eye to your right eye, around 15 inches apart. Very good. The fundi is round, it's present, it has a red reflex, and there is the optic disc is also noted. It's like a circular orangey yellow circle, which is a normal finding. It has that glow. Any other finding would be indicative of some type of other disease process. It measures about a 1.5 millimeter in size. There's no bulging and no papillary edema was noted, which is also a sign of other disease process like elevated intracranial pressure, meningitis, subarachnoid hemorrhage, trauma, lesions, or masses. The retinal vessels are also present in the exam. They're narrow and they're visible, and there's no signs of hemorrhage and no swelling, which is all a good sign. Next, we're going to be checking out the ears. Starting with this part of the assessment, I will be using my tuning fork, and we're going to be performing the Weber test. With this test, we're testing for lateralization and for conductive hearing loss. I'm going to tap it, and I'm going to firmly place it at the top. Do you feel it on both sides?
Yes.
Okay, very good. This is a normal finding when you feel it on both sides. If there was vibrations only heard on one side, that is abnormal and indicative of conductive hearing loss. For this next part of the exam, we're going to be doing the Rhine test. The Rhine test, I'm going to be tapping here, and we're testing for air and bone conduction. I'm going to be tapping and placing it on the mastoid bone. Let me know when you stop feeling the vibration. Okay, and do you hear this?
Yes.
Okay, very good. So this is a normal finding. Air conduction is greater than and more sensitive than bone conduction. If there was any other abnormality, it would be indicative of some type of like conductive hearing loss. Next part of the assessment, we're going to be checking the tympanic membrane with my otoscope. I will be pulling the pinna up and back, looking at the tympanic membrane, which should be gray and translucent. I also see the cone of light, which is a reflex of my light. Very good. And I see no bulging, there's no debris, there is no swelling and no foreign objects, which is all a great sign. For this next part of the assessment, I will be checking with my pen light the mouth. Can you please smile for me? Okay, very good. So can you stick out your tongue? Very good. All right, so her teeth, she has good dentition. There's no visible cracks. Her tongue is appropriate. I'm also going to be checking the posterior pharynx. Say ah. Very good. The posterior pharynx looks good. The oral mucosa is pink and moist. There's no ulcerations present. Everything appears to be intact and good. Okay, no exudate on the posterior pharynx, no swelling. Her tonsils are not present, so it's a grade 0 at this time. And her uvula was moving appropriately, which indicates cranial nerve number 10, the vagus nerve, is intact. For this next part of my assessment, we're going to be checking the neck and the thyroid. Starting with inspection, her trachea appears to be midline. I see no deviations. I'm going to be palpating to make sure that the space between the trachea and the sternocleidomastoid muscle is symmetric, and they are. Now I will be palpating from behind. Over here, I have the suprasternal notch and the cricoid cartilage. The thyroid will be in between those two, on top of the suprasternal notch and below the cricoid cartilage. I don't feel any deviations. I don't feel any goiter, and this is non-tender. There's no lumps or bumps on the thyroid. Can you please swallow? Very good. So the isthmus of the thyroid rises under my finger pad. Over here, I'm going to be checking now the lymph nodes. I'm going to move my patient to the side. Everything is done bilaterally, but for purposes of this assessment, we're doing it just on one side. So over here, we have submental, submandibular, parotid, preauricular, retroauricular, occipital, retrostyloid, posterior cervical, anterior cervical, and supraclavicular. These are our lymph nodes, and the lymph nodes should be soft, mobile, and non-tender, around a pea size, 1 to 2 centimeters in size. And this concludes our HEENT assessment. Thank you very much.